Yo, what's up guys? This is going to be a different video today. I have my dad with me. He's a physical therapist. He's going to cover 3 reasons why you need physical therapy after a total joint replacement. So let's get into it.
Hello, my name's John Tracy. I'm a physical therapist at Holy Redeemer Sports Medicine in Huntingdon Valley, Pennsylvania. I've been a therapist for over 27 years. Redeemer Health also has centers in Feasterville and in Richboro. And we also have a wonderful home care. Each year, over 1 million people in the United States have total joint replacements to improve their function and mobility. In front of me here, I have 2 models of joint replacements. This is one of the knee. You can see how it's capped on the top of the tibia and on the bottom of the femur, and also on the back of the patella to protect the bone. Here's the hip. You can see how it's capped on top of the femur and on the acetabulum or the pelvis. But surgery is organized trauma, and it's only the first part of your recovery. Here are 3 reasons why you should have skilled physical therapy after your total joint replacement. Reason number 1, in the early stages of recovery, physical therapy plays a crucial role in management of pain and swelling. Therapists use things like cold compression pumps, compression stockings, modalities, hands-on treatments, will monitor positioning and talk to you about your pain. Therapists are also trained in wound care, scar management, and vital signs. Therapists recognize the signs and symptoms of inflammation and blood clots and will promptly report these symptoms to your physician for quick care. Reason number 2, physical therapists are trained to identify abnormal gait patterns. After your surgery, you may have limitations in your knee bending or flexion range of motion. This will prevent you from doing things like going up and down stairs properly. You won't be able to get around on a stationary bike, and you won't be able to get around on a regular bike if you don't get your knee bending range of motion back. If someone has difficulty with knee extension or straightening after knee surgery, they'll have difficulty with heel strike. Their leg won't go completely straight when they're walking, and they'll have decreased stride length and speed of gait after their surgery. For total hips, there's 2 approaches mainly. The anterior approach, a lot of times the hip flexors are involved, and what that'll do is make it painful or difficult for you to raise your leg to get it in and out of the car, get it in and out of bed, or get it up a step. If you have the more popular posterior approach, sometimes you have weakness and pain in your hip abductors. The hip abductors stabilize your new joint leg while you advance your other leg. The problem of not fixing these is that you have an asymmetrical gait pattern. And if you develop that, you'll usually develop pain with walking. Physical therapists are also trained to instruct people in how to use assistive devices. They recognize right away whether or not someone will benefit from an assistive device and improve their gait patterns. Reason number 3, therapists recognize that each person is unique and they have their own set of goals. Physical therapists take into consideration health history, age, occupation, and their goals. Therapists set realistic expectations for recovery. They develop individualized treatment plans and home exercise programs. In contrast to a personalized approach, some physicians will tell you after surgery, just walk yourself back to health. And this isn't always a good idea, especially if you have needs like decreased range of motion, strength, and a problem with your gait that are not addressed. So therapists identify issues with swelling and pain early in recovery. They identify abnormal gait patterns and will address these patterns and they'll develop an individualized treatment plan and home exercise program for you after your total joint replacement. You deserve home therapy and outpatient therapy to meet your goals and optimize your recovery after a total joint replacement.
Thank you guys for watching the video on why you should have physical therapy after having a total joint replacement. I want to put links down below to Redeemer Health's website. If you need therapy or any sort of rehabilitation, consider coming here. I appreciate you guys, and I will see you all in the next one. Peace.